Good morning, everyone. I'm Kimberly Chalia with PHCA. Thanks so much for joining us for today's webinar. A few quick updates to share before we get started. This webinar is being recorded and will be made available on the PHCA website. The webinar has been approved for 1 continuing education credit for all PHCA members in attendance. As we begin today, all attendees should be in listen-only mode. Please feel free to submit your questions utilizing the chat icon at the bottom of your screen, and we'll make sure to answer as many of those questions as possible at the end of today's presentation. And now I'll turn it over to our presenter, John.
Thank you very much, Kimberly. Can everyone hear me okay?
I can hear you.
Okay, great. So I'm John Ruffner, CEO of Skilled Cyber. Skilled Cyber is a cybersecurity and compliance business focused on senior living facilities in the Northeast, from Pennsylvania to New Jersey to Maine. I've been involved in managing information systems within skilled nursing and assisted living facilities for over 20 years. My wife, Karen, is a director of clinical services at a SNF here in Connecticut. I'm also a proud graduate of Penn State, along with my sister and both of my parents. My wife and I just spent a week on vacation in Milford, PA, along the Delaware, one of my favorite places to relax in the Pennsylvania forest. Today, we're going to talk a little bit about how artificial intelligence, or AI, is already on the job in your facility, and how AI management influences the risks of running your facility today. So I'll first review some learning objectives, and I hope they meet your expectations. So understanding what AI is today. Now, this is a very fast-moving topic, and a little disclaimer, a couple of these slides have changed from the slide deck that was available for download. However, the content of the slides remains unchanged, or there may be some brief updates for clarity or grammar. So we're going to talk about the 2 models of AI, generative AI and machine learning. We'll talk about what the key purpose is of each model, and then how the models make decisions. We'll talk about where do you use each model, and then we're going to move into the risks and dangers, how the AI model affects the risk, what responsible adoption looks like, how to avoid data leakage outside of your organization, a couple of unique risks with AI, some supply chain risks, and the risk of accuracy and repeatability. Then we're going to move into some of the most promising applications in AI senior living, where we'll give you some basic idea of what wearables are like, what predictive analytic tools are like, medication management, enhancing operational efficiency, and improving resident experience. We'll talk about some ethical and practical considerations, some cost, benefit, and ROI, and then what about the future of AI? What are the most promising technologies and obstacles for AI development? So we'll quickly move into discussing or letting you know about the 2 models of AI. So machine learning and generative AI are the 2 most common models of AI in use today. Generative AI and machine learning are related but distinct concepts within artificial intelligence. While machine learning forms the foundation for generative AI takes a step further by not just analyzing the data, but creating new content based on the learned patterns. Both technologies are crucial in advancing AI capabilities and are reshaping how we work in a fundamental way. Let's talk about some of the differences in a little more detail. So, for machine learning, what's the purpose and output of each model? In machine learning, it focuses on analyzing data to identify patterns and make predictions and provide insights. It typically produces decisions, classifications, or predictions based on the input data. And we'll get into how this works in real life with some of the models that we'll talk about, some of the products that we'll talk about in a moment. So an example of machine learning is a fall detection system. And in a fall detection system, the sensors look into a room, see what's going on, they identify a pattern, and then the pattern may be someone standing up or someone falling. And by analyzing the data and using the algorithms, it produces a decision. Did the resident fall, or was this normal activity? Let's talk about generative AI for a minute. Generative AI aims to create new and original content that mimics the patterns in training data. Of course, if your training data is flawed, then the output from your generative AI model is flawed as well. This generates an entirely new data like text, images, audio, and video. I'm sure many of you have seen what some of the generative AI videos can do these days. And examples include ChatGPT. I think just about everybody's heard of ChatGPT for text generation. And then there's DALL-E for image creation. There's Microsoft Copilot. There's Gemini from Google. And there's Apple Intelligence from Apple Siri. Now, people may have been listening to the news and realized that the newest iPhone has come out. And that new iPhone now includes Apple Intelligence, which is generative AI built right into your iPhone. So generative AI is already in use by nearly everyone. Let's talk about how these models make decisions. In machine learning, the machine learning uses the algorithms to learn from and analyze existing data. So it is constantly learning. Work can be supervised, unsupervised, or use reinforced learning approaches. And then it often relies on statistical models and pattern recognition, as I discussed with the fall system. Looking at generative AI, this builds on machine learning techniques, but adds creative capabilities. It uses advanced models like large language and large data models. I think some people may have heard of reports of ChatGPT and ingesting every single written word. That's large language. And generative AI, because it's trying to produce new content, involves more complex training processes to enable the content generation. So where do you use each model? Machine learning is widely used for predictive modeling, recommendation systems, and data analysis. It's common in fields like finance, healthcare, and cybersecurity. And generative AI excels in creative tasks and content. I would imagine that many facilities today use generative AI, ChatGPT as an example, to generate marketing content and write marketing emails and content for websites and so on. It's used in entertainment, design, and content production industries, and it's gaining traction in fields like drug discovery and product design. So generative AI is now branching out into a wider range of fields, and it's beginning to generate new products itself. So with all this happening with machine learning and generative AI, it's key to understand how to manage the inherent risk. So with machine learning, you typically assess machine learning using quantitative metrics like accuracy, precision, and recall. The focus is on predictive performance and error rates. So if we look at the example of the fall detection system, it is going to produce both positive and negative results. That is, maybe it says that someone fell, but in reality they didn't, or maybe it didn't detect someone falling and they did. So you should be thinking in terms of, how do I keep track of the accuracy in the machine learning model? You might be thinking of a log or something similar, so that you can know over time how accurate the machine actually is. In generative AI, we evaluate using both quantitative and qualitative measures, and metrics include realism, coherence, and a diversity of content that's generated. So one of the things that happens with generative AI are hallucinations. And you may or may not have heard about generative AI producing results that really are impossible based on the information that you gave it. And that's called a hallucination. And that's an inherent risk that someone may take a hallucination and actually use it in your facility. So how big is AI? Many generative AI platforms handle over 7,000 requests per minute. That's according to the Data Never Sleeps report from Dumo, a respected AI researcher. And then generative AI has the potential to generate value of 2.6 trillion to 4.4 trillion in global profits annually, according to McKinsey, the management consulting firm. So we can see that AI is enormous and getting bigger. Stopping AI is nearly impossible. This switches the conversation from reeling it in to responsible adoption. So let's talk about what responsible adoption looks like. I've got a series of steps here that'll kind of take us through how to responsibly adopt AI. And step one is to implement 2 AI policies within your organization. The first one is an acceptable use of AI policy, which will lay out your decision one way or another to yourself, your team, and to your vendors about whether AI can be used in your organization or not, and to what extent. The second policy, artificial intelligence security policy, digs deeper into what constitutes what is responsible use of AI in your facility from a security perspective. Do you want employees randomly entering residents' names in one model of AI or another? Some systems may already have AI components, such as your EHR system. And of course, it already has your personal data in it. Other systems like generative AI ChatGPT are terrible places for personal data. We'll talk a little bit more about this in a minute. So some key points to address in your policies. Are generative AI apps and services allowed or prohibited? If allowed, which ones are officially endorsed? Who in the organization is responsible for approving use, and who in the organization is responsible for implementation? And finally, what is considered acceptable or unacceptable use? Like any policy, they have to follow the policy implementation pathway. And so a policy advisor typically creates the policy, and then it's reviewed by senior management or your compliance officer. Once it's reviewed, it gets approved by a senior manager, such as a CEO, and then it gets shared to the appropriate group of staff that may use AI. And finally, it gets accepted or attested to by the appropriate staff members. So step one, implement policies to control your use of AI. Step two is to procure a business or enterprise subscription plan for a generative AI platform. We know that it's highly typical for people already to be using generative AI in a facility. And let's talk a little bit about ChatGPT for a second. When ChatGPT launched to the public, it required a personal account. Users flocked to it, excited to see what they could do. ChatGPT Enterprise was introduced in August of 2023. It is very different from the personal version, as you'll see in the next couple of slides. Cyberhaven Labs conducted research in 2024 showing that the usage pattern of 3 million workers show that 74% use non-corporate or free accounts. So why is it so important not to use a free account in your facility? Well, let's take a closer look at the difference between the plans. So in a free account, it's definitely designed for individual users. This is fine for use at home and to play around with until you get used to what it can actually do. So there's a limited number of queries typically, or generations per day. 5 to 10 queries on a personal account is common. It's got lower processing power and speed. If we look at the enterprise side, it's built for security and user management first. It has a higher number or unlimited query generation limit, and it has increased processing capacity for faster results. It's not uncommon for a complex query to a generative AI platform to take 5 or 10 or 15 minutes even to produce a result. With enterprise, that typically gets cut down to a few seconds. On the customization and feature comparison, we can look at the standard models and capabilities. You don't really get to change how AI works with a personal or free account. You get limited ability to fine-tune or customize the models, and then you get basic integration options. Maybe you can put in some Word documents or something. On the enterprise side, however, you get the option to fine-tune the models based on your company data. In fact, it can actually learn from your company data how to better answer your questions. It gets advanced features like content filtering and moderation. So maybe you want to put some boundaries on what your employees are allowed to enter into a generative AI product and what kinds of things that you want to moderate the results from. And then you get extensive API access for seamless integration to existing systems. So with your EHR system, the vendors to your EHR system, the add-on products, if you will typically use APIs or application programming interfaces to integrate with your EHR system to produce results. But you can also use the API maybe to take a look at all of your Word documents on your network and your Excel documents, then ask the enterprise version of a generative AI product to find data in your system. And it can quickly consolidate all of the data on your files, Excel, Word, PowerPoint, etc. So if it's going to look at your own data, your question really should be about security and privacy. In the personal one, you get basic security measures. What does that mean? A username and password is typically all it means. The data that you put in to a free account could be used and saved by the AI model to improve it. And then limited control over data retention. So you may put someone's name into the free version of ChatGPT, and guess what? That person's name may be in there forever. With enterprise, you get enhanced security protocols and encryption. You get options for data isolation and private cloud deployment. So your personal or corporate data never goes into the actual public model. It's simply stored for your own use. And finally, and this should be the nail in the coffin, so to speak, the compliance, the enterprise version is compliant with industry-specific regulations such as HIPAA, PCI, GDPR. If you have European residents in your facility, GDPR should be a concern of yours, and FTC safeguards. And we are seeing the Federal Trade Commission get involved in data compromises. And so you should be thinking about FTC safeguards in the future. So great, get an enterprise account. What else do I get with it? So support and training. The personal or free account, you get limited customer support, often through online resources. You get self-service troubleshooting, which is effectively ineffective, if I can say so. In the enterprise account, you typically get a dedicated account manager and a technical support team that'll help you get the best value out of your investment. You get training sessions for employees, and you get custom onboarding and implementation assistance. So what's the difference in the cost? Personal accounts are typically free or they're low cost, speaking, $10 to $15 to $20 a month, often with simple subscription models. You also get pay-as-you-go options. With enterprise, it is higher cost, reflecting increased demand, increased capabilities and support, and you get custom pricing based on specific organizational needs. And finally, if you're a large organization, you can get volume discounts for large-scale usage. So you should see here that having an enterprise account, although it's more costly than a free account, basically allows you to be HIPAA compliant and make sure that your data never escapes out into the public. Step 3, understand the inherent risks of AI. So we have two different kinds of risk with AI. You have what's known as model inherent risk and non-model inherent risk. And the model is either the machine learning or the generative AI. That's the risk we're talking about here under model inherent risk. So the risk is that you get dangerous, unsafe, or unreliable output. What happens if an attacker gets control of how the model delivers its results? So you have that risk. And finally, you have misinformation or biased responses. So if the algorithm is programmed based on the biases of the person who created the algorithm, then all results will be biased. And I think we've heard stories about how generative AI is biased to a certain extent because of the programmers who actually created the algorithms. So typically the training model, the party that was training the model owns the risk or the model inherent risk. On the non-model inherent risk side, we have user credential compromise. This is typical of your network, your EHR system, and so on. This is user risk. Then we have infrastructure level attacks, such as denial of service. You can't get to the particular product that is using AI. And this is the service provider, a ChatGPT or other service provider. And then you have supply chain vulnerabilities, and you can think about what happened with the Change Healthcare attack, if anyone's familiar with that. It disrupted not the people who were, it disrupted the entire process, and it was in the supply chain. You might not have even known that you were using Change Healthcare in the process of using your product. So that's a summary of the risks. We'll move on to step 4, which is to choose an AI application. And it might not be obvious, but you need to start with the problems that cost the facility the most money or cause the most expensive problems. And we'll start with some simple options. So wearable devices and sensors. There's a list of these, the smartwatches and fitness trackers. They track vital signs such as heart rate, blood pressure, and physical activity. The Apple Watch and the Fitbit and the Garmin are classic examples of smartwatches and fitness trackers. We have medical alert systems, devices with built-in fall detection and emergency alert buttons. Even my Apple Watch will do fall detection. Examples are Life Alert and Medical Guardian. And then we have biometric sensors. They monitor specific health metrics like glucose levels, oxygen saturation, and body temperature. And these examples include continuous glucose monitors and pulse oximeters. And we have environmental sensors placed around the living environment to monitor movement, room temperature, and air quality. And those are motion sensors, smart thermostats, and air quality. So an example of the wearable devices is the Health Center at Galloway Ridge in North Carolina. Galloway Ridge implemented an AI-based health monitoring system that uses wearable devices and sensors to collect data on residents' vital signs and activity levels. The AI algorithms analyze this data to detect early signs of health issues such as heart problems, respiratory conditions, and potential falls. Move on to talk about some predictive analytic tools. And here we have continuous monitoring. This is typically employed by a wearable device, but on top of the wearable device, you have a management system that will provide the executive team with further data to allow you to analyze the monitoring allows the early detection of deviations from normal health patterns. We have pattern recognition. This can identify patterns and trends in resident health data and may indicate potential health issues by analyzing historical data along with real-time information. So this can detect subtle changes in vital signs, activity levels, or other health metrics that may signal an impending health problem. We have risk stratification products. AI can stratify residents based on their risk profiles for specific health conditions or events. By analyzing multiple factors such as age, medical history, medication usage, and lifestyle factors, and AI can identify residents who are at a higher risk of developing certain health issues. This enables you to prioritize interventions and prevention measures for those at the greatest risk. Next, early warning systems. AI-powered early warning systems generate alerts or notifications to healthcare providers when deviations from normal health patterns are detected. These alerts can prompt timely interventions such as medication adjustments, lifestyle modifications, or additional medical assessments to prevent escalation of health problems. We have predictive models. These predictive models forecast the likelihood of future health events based on historical data and current health status. They can predict the risk of falls, hospital readmissions, or exacerbations of chronic conditions, allowing you to implement targeted interventions to mitigate these risks. We have personalized healthcare plans. And here, analytics enable the development of a personalized care plan tailored to each resident's unique healthcare needs and risk factors. By considering individual characteristics and health trajectories, AI can recommend specific interventions or adjustments to care plans that optimize health outcomes. So, who uses this? Well, an example is the Jewish Home of San Francisco. They incorporated an AI-driven fall detection and prevention system using advanced motion sensors and cameras. The system monitors the residents' movements and gait patterns, identifying risks for falling. The algorithms predict risk falls and generate alerts for caregivers to take preventative action. Next category of products that you could consider are medication management tools. And here we have medication adherence to provide medication reminders and alerts to residents, helping them adhere to their prescribed medication schedules. These reminders can be customized based on individual preferences and medication regimes, reducing the risk of missed doses and medication errors. The next class of products are drug interaction detection products. These AI algorithms can analyze patients' medication lists to identify potential drug interaction or contraindications by cross-referencing medication databases and patient profiles. And the AI can then alert your providers to reduce the risks and prevent drug reactions. We have the optimization of prescribing practices. AI can analyze prescribing patterns and patient data to identify opportunities for optimizing medication regimes. By considering health factors such as efficacy, safety, and cost effectiveness, AI algorithms can assist you in making informed decisions about medication selection and dosage adjustment. Next, we have real-time monitoring. The list is pretty long on these things. AI-powered medication management systems can monitor patients' medication usage in real time, providing insights into adherent patterns and medication utilization. We have personalized medication plans. Here, the AI algorithms analyze patient medical history, genetic information, and other relevant data to develop personalized medication plans tailored for individual patient needs. We have predictive analysis for medication errors. AI can analyze electronic health records and medication administration data to identify patterns indicative of potential medication errors. By detecting discrepancies or anomalies in medication orders, dispensing, or administration, the algorithm can help healthcare providers proactively address issues before they escalate. And last but not least, inventory management. The systems can optimize medication inventory management by analyzing usage patterns, expiration dates, and supply levels. So, Masonic Village at Elizabethtown, Pennsylvania, deployed an AI-based medication management platform to streamline medication administration and improve adherence among residents. The system uses machine learning algorithms to manage medication schedules, provide reminders, detect potential drug interactions, and it also monitors residents' compliance and alerts healthcare providers to any deviations from prescribed regimens. So as we go through all these different possible tools, you need to consider which problems your facility faces, and there will be a solution, an AI-driven solution, that may help you improve your care delivery. We'll talk about some operational efficiency tools, automated administrative tasks like chatbots and virtual assistants. We have optimized staffing that looks at patient census, acuity levels, and staffing patterns to forecast future demand and optimize staffing levels. We have streamlined workflows. So in large organizations, they can benefit the most from this type of thing, but by analyzing the inefficiencies in clinical processes, AI can recommend improvements to streamline your workflow. And make no mistake about it, with AI, the workflow that you're currently using will probably need to be adjusted when you implement an AI tool. Enhanced clinical decision support. So we're seeing that machine learning algorithms assist in diagnosis, treatment planning, and medication selection by synthesizing all of the information available to it and recommending evidence-based best practices. Predictive analysis for maintenance equipment. So wouldn't it be nice to know that the bearing in the air conditioning unit's about to fail and you need to get that replaced before the long weekend during the summer? And we have supply chain optimization. Again, this is more of a large organization type use of AI, but figuring out which suppliers that you can eliminate from your system and optimize your supply chain. So then there's telemedicine and remote monitoring. This platform enables remote consultants or consultations, diagnostics, and monitoring of patients, reducing the need for in-person visits. And then finally, we have quality assurance and compliance. So here, AI automates the quality assurance process by analyzing healthcare data to identify trends, anomalies, and areas for improvement. Here we have Communicare, Cincinnati, Ohio. Communicare uses AI machine learning and big data technology to save MDS and case management teams precious time, effort, and headaches while positively impacting the reimbursement potential of the operation. And who couldn't use more revenue in today's environment? So this is probably the largest area. I'll kind of blow through this pretty quickly, but we're really looking at a lot of different tools that can improve resident experience. Some include enhancing social engagement by connecting residents with family members and friends, cognitive support and mental health that facilitates social interaction and engagement, connecting through games, puzzles, and interactive activities designed to maintain and improve cognitive function. We have diet and nutrition that analyzes the dietary needs of residents and creates preferences for personalized meal plans that meet nutritional requirements and cater to individual tastes. We have enhanced mobility and accessibility, such as voice-activated systems for what we'll call home automation, or let's say HVAC automation or lighting, to allow residents to control their environment. We have efficient communication, so natural language processing chatbots that can assist with inquiries and provide information. We have recreational activities such as virtual reality and AI-driven interactive content to provide an immersive and enjoyable activity that enhances residents' quality of life. We have family and resident communications. And here, these assistants and chatbots can handle routine inquiries from families, providing information about the residents' health, activities, and schedules. We have automated updates and notifications. AI systems can automatically and regularly send updates to family members about their family members' health, status, medication schedules, and daily activities. And these personal notifications can be sent through SMS or through dedicated apps, keeping the families informed and engaged. We have emotion and recognition and sentiment analysis. So here, this is kind of a cool little thing. AI can analyze residents and family members' facial expressions and tone of voice during video calls to assess emotional states and provide insights to the caregivers. We have smart home devices and assistive technologies. And here we have AI-powered smart home devices that can enable residents to communicate more easily with family members through voice commands. Devices like smart speakers can facilitate calls, send messages, and even control the environment. And we have activity sharing platforms, the last one in this list, I think. These platforms can include photos and videos and updates to family members so that they can stay connected. One more, language translation. With so many different languages being spoken here now, the accessibility features that are available, such as speech to text, text to speech, real-time captioning, ensure that communication is both inclusive for residents with hearing or speech impediments. Who's using these? Well, Brookdale Senior Living in Tennessee introduced AI-powered cognitive stimulation programs for residents with dementia and other cognitive impairments. These programs use machine learning to tailor activities and games to individual cognitive levels and preferences, enhancing the engagement and cognitive function of the residents. Step 5, take stock. Take stock of your current usage. This is the simplest step of all of these, and create a log or a list where AI is used. Start the list by adding every known vendor and eliminate the vendors as needed. You might be surprised at how many vendors actually are using AI. Pay attention to common usage, like Alexa and Siri. Those are considered AI, and their use needs to be documented in your system. Look closely at your EHR system and its subcomponents. If you're purchasing additional add-on components to your EHR system, some of those components may be using some form of machine learning or generative AI in their output. Step 6, assess your vendor. So AI is not just another vendor. It's not just another IT vendor. It is handling and manipulating data, but it's also making decisions. And so treating AI vendors as just another IT vendor is really a big mistake. You need to know who owns the data that's used in the product. Is your data now owned by the vendor providing the service? What model is being used by your vendor? Is it machine learning or generative? This reflects the risk back to you. And is the model trained on your data or some other source? So often the systems will come pre-trained. The fall management systems usually come pre-trained, but other systems may train themselves on your data. How good is your data? Where specifically is your data being stored? So it's possible in today's IT environments that data is transferred in different states, in different countries. You want to know where your data is being stored. What is the decision or prediction accuracy? Your AI vendor should be able to give you some indication as to the accuracy of their results. Is data anonymization performed? And if the vendor is ingesting your data, does it still have the resident's name or resident ID on it? Is your data encrypted while in process? And what security is in place at the vendor? Are they SOC 2 compliant? Are they HIPAA compliant? Are they GDPR compliant? Can they show you their compliance status? And how reliable is the vendor's infrastructure? So if the vendor is providing critical services like fall detection, how reliable is the actual infrastructure? A 99.99% accuracy, if you work it out, means the system is down for a couple of days a year. And can you have a copy of the vendor's incident response plan? This is a critical question that often gets overlooked when assessing vendors in a skilled nursing or assisted living facility. You want to know how the vendor is going to react if they detect an incident, and that's a capital I incident, meaning it's significant. Step 7, assess the cost and benefits. All of these products come with a certain level of cost and a certain level of benefits. So when we look at costs and benefits, you want to look at the return on investment. And let's talk about wearable technology here, where the costs are associated with implementing wearable technology can be substantial. The potential benefits in terms of improved care quality, resident safety, and operational efficiency generally justify the investment. Careful planning, budgeting, and evaluation of ROI are essential for successful adoption and utilization of these technologies. Most important and usually overlooked is that ROI must be maintained over the long run, and therefore long-term supervision of the system is a must. So in terms of costs and accessibility, you have to look at both the hardware and the software costs, the integration and implementation costs, the training and education costs, the data management and security costs. Now, these may be once a year costs, but is something that you need to look at before you get into the product itself. Maintenance and support. How much does it cost to replace the wearable device? And what happens if you need support? Some vendors charge extra for the support. And scalability and expansion is something that is often overlooked, but I would suggest that anyone looking at AI solutions consider where it's going over the next few years and where you might want to add additional AI products. And so you need to look at the vendor in terms of what else do they offer, how do they integrate, and if you decide that you want to do 2 or 3 more projects over the next couple of years, are you starting from scratch with each one, or do they build on top of each one? All right. Step 8, consider the ethical and practical. So first thing we look at is anomaly detection. From an ethical side, AI systems will make mistakes. How much faith do you have in the decisions? And what is the potential harm from a wrong decision? So if you're entirely relying on that fall detection system and it fails, what is the potential result from that wrong decision? So from a practical side, you need to understand how to monitor the AI decision process. Is it going to be an automatic system or a manual system? And are you looking at the results in detail or in summary fashion? And then what is the process if a wrong decision is detected in the system? So if you detect a wrong fall, is it just, oh, well, or is it, ooh, we need to reposition the sensor, or is there some other tuning element that needs to happen? Threat protection. So this is a big deal in AI. And of course, all across the senior living environment, threat protection is an enormous problem. So AI depends on both human and automated learning. And what are the possible threats to the decision-making process? Well, how do you know if the system has been compromised? And who is responsible for informing you? Does the vendor have an information, a way to inform you? And what does that look like? And what is your plan if the system has been compromised? Okay, so your resident fall system that you've put in place is great, but now it's been compromised. What do you do? So access control monitoring sounds pretty simple. Who's allowed to access the tools? If it's a resident, is the resident a good candidate for the tool? Is the resident a good candidate for that wearable? And if it's an employee, are they properly trained? Practical considerations, a written decision criteria for the use case of your AI, and training and knowledge testing for your users in terms of accessing the system itself. We'll talk about data. I'm going to screw this up. Anonymization. There we go. The last thing you need is a data breach. So it's your responsibility to ensure shared data for the system is not traceable to a specific individual. So on the practical side, written rules on how data is de-identified and testing the de-identification process. And training and awareness, getting close to the end here. If AI is in use, do you know about it? And are there regulatory requirements that are impacted by the usage of the technology? Can you show that administration users are properly trained? And can you show that direct care providers are properly trained? And finally, are you able to provide the detailed information on the usage of AI to regulators, residents, and staff? And I believe incident response and management, your need to protect residents, you need to protect residents under your care. Do you have a plan if something goes wrong with the AI component? You need to have a written incident response plan specifically for the product. And you need to develop ongoing management protocols to keep up with new developments in the tool. And I suggest that you perform a tabletop exercise to discuss the what ifs for potential incidents. For policy enforcement, create policies that ring fence usage of AI. In other words, we can use AI here, but we can't use AI over there. And the practical side is you need to write the policies and you need to implement consequences for the failure to adhere to policies. Talk about workflow automation real quick. Does the new use of AI introduce new complexities for staff, residents, or families that are overly burdensome? I can tell you that every AI usage that we've seen, you have to modify your existing procedures and protocols to account for the new use in AI. And you need to train the staff, of course, on new procedures and protocols. So what about the future of AI? Clinical decision support tools are designed to improve care quality and patient safety. This is clearly an area where significant product development is in place. Patient engagement is another area that we can expect to see a lot more products coming to market and improving. Predictive analytics and remote patient monitoring. And finally, revenue cycle management. So we see some of the best bang for the buck, if you will, under revenue cycle management, making sure that your MDS department is accurate and complete. So here's some limits to the future development. Today, there are too many AI developers without a defined problem to solve. So we need people to step forward to say, I have this problem and I need it solved. And current workflow versus AI integrated workflow. And then lack of testing. So one of the biggest problems we have with AI today is that it's not fully tested and validation and safety effectiveness is not fully understood. We get concerned mostly with hallucinations from generative AI in terms of its ability to deliver on its promise. So then we have haves and have-nots. So AI is not exactly cheap. It may not be all that expensive, but it's not exactly cheap. And some facilities may not be able to implement AI. And so we do have a situation where the haves and the have-nots exist. Back to life, I guess. Some do's and don'ts. Do's, develop a policy to govern use. Try it out. Create a personal AI account and play with it. Ask it medical questions and non-medical questions. Just don't give any PII. Investigate what products work with your existing systems and dig deeper into what the vendors are doing with the data. Never, ever put PII or proprietary data into a generative AI system without a properly configured enterprise account. Never rely on AI for critical or ethical decisions. AI is notorious for not being ethical. And use AI and don't use AI without understanding your vendor relationship thoroughly. And there you have it, artificial intelligence in senior living. I hope we met some of your expectations. And that's
Thanks
it.
so much. Thanks so much, John. That was some great information. And I see, John, do you have your email that you can share via chat? I didn't see any questions come through in the chat box during the presentation, but it's not uncommon for attendees to submit a question later on. So if you could share your email, that'd be great. If not, feel free to reach out to me at kchalia@phca.org, and I can certainly forward any questions over to John. John, are you looking for the chat?
I found the chat
Thank
and
you.
it's going in there. Too many screens.
Thank you so much. And I appreciate your time today, everyone. And John, like I said, if I get any questions, I'll send them over to you guys.
Okay, great. Thank you very much.
Thank you.